Now, this is on the image diagnosis. But it's not the only thing that we see around. When we go ahead, we even have other, other signals which
இதுக்குள்ள போடு யுமி இந்த இதுக்குள்ள போடு
it takes our PCG. We listen to our heart sounds. These are the very essential things that they look at. Now, why do they look at that? Because they are trained with those signals, They know that if your ECG is like this, if your ECG is like this, you are good. If there is a these are like ECG, if it is like this, you are good. If there is an abnormality in there, you are not good. The doctors are trained with it, so they look at the ECG, this is it. But now, this understanding I can feed into the machine also. What we can look at these kind of ECG symptoms and understand how is their behavior. Now, how does it look? I don't have to go to the doctor. I can look at these ECG signals and do the analysis over here. Okay, so this is an abnormality and that is what is happening with it. This, even, so this is another work that we did, and this is very close to me because, my father was an asthma patient. I could understand by his stuff that the way he was speaking, that he is having some breathing issues. I can understand as a caregiver. A doctor understands, because I have only one patient there. The doctor can understand much better because we have many patients to handle. So we can design a system by which a machine can understand. It is just, understanding that we want machine to get. So basically, machine is saying exactly that. Now, over here, the feature that we use, and it can be a feature-based thing that can be done, or you can ask machine to read the picture structure. That is the next level of processing that can be done. Now, another important thing that is happening these days, I mean, I have fever, like I take a paracetamol, I get pains, I take paracetamol, I get cold, I feel cold, I take paracetamol, and that's advertising it, but that's how we are very prone to certain medicines, and these medicines are very generic ones. Why it is generic medicines? So why the doctor is why the pharmaceutical companies are designing those medicines? How the medicine is being invented? That is something which I think I can explain you better. What we have is, this is our protein structure. Now what we want is, whenever there is a challenge that happens, there is some problem in the structure of our wherever we want to affect our body. If there is a tumor, the molecules over there are having some which should be going and sitting there and should treat me. That is what I should do. That is what it should be. Now what is being done here? We assume that now we say that okay, the tumor is because of 3-4 things, and those 3-4 things we know that it is, and we provide antibiotics based on those 3-4 things. I give lastly antibiotics, I give those kinds of antibiotics depending upon the kind of broad classification of the things that are happening. So many of times, you do the blood collection. and gut culture gives you the strain of affecting your blood. And then doctor prescribes you the medicine based on that. Okay, so for different kinds of infection, you get different kinds of medicines that we have. Now another issue that happens. So there are two things that are. Now when I design it, I should know the strain. But you know, we have three, four popular strains. So what we do is we have categorized them into those classes. And we try to treat them with those medicines also. We have designed the medicines for those three, four, five classes of strains. I mean, how the research is progressing, more strains and more infections have been tackled. But so that's why the life expectancy has increased. But you know, there still there are many diseases for which we do not have medicine. Why? Why do we not have medicine? Because the process by which we do design the drugs is very complex. So we do all experiments. Take out those infections. We try to put all the molecules there. If they fit, only then there is a success. If they do not fit, there is no success. So what we do is we take our infection molecule, we take synthetic drug and we try to fit it over there. If it fits, it's good. If it doesn't fit, it is not good. You know, but all this requires an experimental setup. Understand how costly it is. I need to get those samples. I need to preserve them. I need to prepare my chemical that I should take and test it. And you know, it's a trial and error. Composition and design. 100 composition possible, and I try this 100 composition. Never succeed in all 100 compositions. But if I succeed, I'm able to design a new drug. But if I'm not, I'm still a band. Over here, I can use the simulate this thing. The first thing that I can do is simulate these chemicals also. We have the structures and the chemicals. That is people said that they did research and they gave a composition that can be synthesized. Now what I need to fit is I need to fit this structure into this problem. Now, how does it come? I need to invest computer time, but all my physical networks have been saved. I can, now, another thing is, if I have 1,000 things in my mind, I can look at the simulation data. My experiment. My experiment becomes okay. So my drug discovery has become better. I'll be able to design my drug better. I can design the drugs for various other strains which are not being designed. That is also because of AI possible. These faster computations and all such algorithms are made better. Moreover, another thing, you know, I mean, that is happening is when personalized disease. Why do I take paracetamol? Why should I take that? How much amount of paracetamol should I use? It is not saying, you know, it cannot be generic for all whatever is the 100 crore population of India or the world. There has to be a different drug for my fever and your fever. When I get my tailor-made prescription, why can't I make my drugs tailor-made? So this is also possible because of the AI. I can search the same principle and I can search and get my personalized medicines. And these personalized medicines is going to change the way you live. You know, because every drug has its side effects. Why it has a side effect? Now what happens is, whenever you have a tumor at one. But when you give a drug, that it will just try to fit into your all the tissue. It will not know the tissue is infected or not. It is going to affect your body. But when you are taking a personalized medicine, that effect will be. So I think the only with AI in the complete power. I mean, these are the ways where we are working and trying to make our healthcare better. There are other things also that have been done and across the world to do it. Even the hospital management, hospital records management, these are all AI driven. I mean, if I keep going on, I'll be just kind of saying the applications by which we can make our healthcare sector much, much better. But I thought that I'll talk something more about it. So, as we all are research scholars in capability over here, so you know what is AI. So what we need to do with us, we need to make these systems more robust. We need to design, what is AI, what is a neural network is? Neural network is, I have the network of these neurons which work. Now when I see this image, when I see the image, a certain part of neurons when I look, when I hear some sound, but other parts of the neurons are active. What I need to do, I need to design models such that I activate those portions and take my decisions accordingly. I take my decisions accordingly. So I need to work towards that. All the algorithms that I've designed, till now we have designed supervised programming, many kind of data that we have worked on. But we should make our models much more specific, much more robust, so that we can handle the tasks where we are going on. We know that this is the image data we are looking for these features. So can I design the models which are uh, more personalized or more better for those kinds of problems that we look at? I mean, it is not only we get a good kind of images. We might, most of the problems which we handle is because of the video generation. I mean, there, the camera quality may not be that good. I'm not sitting in a hospital where I get a very good quality image. I am living in a very family healthcare setting where I want my things to reach there also. So our algorithms that we should design, we need to design those algorithms which can take care of real life problems and people to start. I mean, presently what we have is we don't have specialists. As I said, retinal specialist. This happened with my own mother. She lost almost one because it took the time for us to the correct doctor. The specialists are short. I mean, even today I just went to view and can look at the pathologic condition. So many patients are there, and doctor is few only. When I need to take a decision, I need to take a decision with a very cool mind. So that is not possible in a present setting. So we need to have AI solutions which can be given to the doctor to help them in taking a better decisions on it the that now another thing, when I decide, it's always a saying the cup is half empty or half full. This is my own perception. Everybody has a different perception. So doctor only gives you suggestion, a diagnostic suggestion. But I mean, at those things when it can be this or that. That is a variability, subjectivity also comes. A human can be subjective. A machine may be less subjective. I'm not saying not subjective because only humans have made those machines. It may not be that subjective. So our quality and our treatment may be better. That is why I think that clip I showed you makes much more sense because a mother is more concerned with the child. She knows in and out of the child, and with ChatGPT, she has all the time to discuss and understand, and then can come to a diagnostic. Whereas a doctor has a very limited time, a limited peace of mind to understand the child. For mother, it's a one child, and for doctor, there are thousands and thousands of patients there. So this is important that we develop these tools which can help us in augmenting our healthcare system, augmenting uh, our healthcare, our doctors to kind of provide us a better treatment. And this is I mean another important thing which is important. The healthcare sector is way costly. If I can avoid, I can save my money and time. That is always a welcome solution. And these days, we have so much of data with us, so much of people whose complete records are with us. We can leverage them. We have high compute power and the connectivity is so good that we can leverage on that and try to suggest few solutions which can improve the healthcare healthcare society. Now, what we need to do? As we are going ahead, we need to design a unification. When you go to a doctor, he sees your MRI, X-ray, blood reports, blah blah blah, and then take a decision. So we should have a system where we have your all things together. We should have our sensor data, maybe the audio, video, images. We should have your metadata, your past history, whatever possible. All this should be combined, and then I should take a decision on my diagnostics. That is what is required, and that is what is going to happen. And it is happening as we are moving ahead because we have these data available, and we also have that compute power which can make these things happen with us. So what I'm saying is the way we will move, we will be kind of proactive because this healthcare, this AI we provide healthcare to us at our home. That mother could do the things. So if I have some issues in my eye, I can just do the scanning at home with an AI tool, and I can be more. Why only problem? I can do my health checkup only at home with myself, and I can provide if there is an issue. I can do early diagnostics. When we were doing studying on those ECG signals, we found that uh, those ECG signals have a T wave. A T wave gets inverted when you get heart attack, maybe 3-4 days before. So if I can measure my ECG at home and I see these things happening, these things people understand. It is very rare that we do not see that we are moving towards a medical problem. We kind of see some easiness, some 3-4-5 days before tapping it. So those, if I can do that, and only thing is that what we do is we avoid going to the doctor because we see that this might be the weather change, this might be the overwork for those issues, but AI can help us. AI can provide us that tool at home, in my phone, in my laptop, in some devices which I can have and understand those things. So I can kind of work in a predictive manner so that I can understand my things and I can prevent those uh, those disasters happening to me. I do not want one medicine. I want personalized medicine because that can save my life. And that is what is happening. As I said, I want not hospital, I want home. I mean, everything which can be done at hospital can be done at home only. So that is what is kind of becoming better. Now, I mean, it is not that, I'm saying that everything can be done with AI. We cannot remove doctors from it. But what AI can do is it can help doctor in understanding. We have such a small body. I mean, there will be a clot somewhere, very small. AI can understand that clot. It can expand it. It can understand three, four, five features of it. Not only the image, it can take various other parameters and it can combine. So it can augment the doctor decisions. It can help doctor decide better. Ultimate doctor has to take a decision. There is no way that it's been said that AI is going to replace doctor. It can augment the doctor only with only thing. The that is what it is happening. The doctors feel that AI is going to take away things. That is not going to happen. Only thing is that we need to accept ourselves that okay, this isn't this is AI giving the decision. Yes, doctors should also accept that, and as a person, as a patient, we should also accept that. And I should say that I should not say it AI. I should say AI only, but it should be augmented intelligence, not artificial intelligence, because we just want to augment what is being done. This is our intelligent assistant who is going to take, who is helping us in taking that decision. And these decisions is being taken by technology, and then uh, humans are going to kind of understand and help us in solving the complex problems that we have and improving our outcomes that we have. So what I feel is, Janvi asked me to talk about the future. What I feel is the future of healthcare is. I 10 years down the line, I had assumed that there will be a collapse at a rural area, where the way at that time, there was an STD call, and we used to, when I was studying, there was a collapse of home STD place, and where I used to make a phone call to my parents. Nowadays, that collapse has gone. We have the phones with us. So when I started working in this area, I thought that we should have a kiosk where everybody can go and get the diagnostic done. We just have all the gadgets there, and the diagnostics can be done. But now, as the AI is moving ahead, what I feel is, what I emphasize is that along with the kiosk at a smaller primary things, at a big hospitals, it will be AI agents. So as soon as I enter into the hospital, the the, the AI thing will understand my whole whole my whole problems, which and it can make a report. It can analyze my previous reports faster. It can look at me. It can I mean those sensors are available that I can get all those readings. These readings will be kind of used together. Um, these readings should be used together and can be combined, and I based on that I can take the decision better. So I feel that the future is based on AI and an augmented AI, I should say, by which we can provide a very good healthcare system and can make our life much more meaningful and better. So that's all that I wanted to say. If you have any questions, I'm open for that. Moreover, we are working in this area and we would love to collaborate if somebody wants to I mean, I have not given a kind of technical talk with equations, which I feel might become boring at times. But we are trying to develop these algorithms and working at various aspects. And if somebody is interested, we'll be happy to collaborate and work with you. Thanks a lot for listening to me, and thanks a lot for providing me this opportunity. I'm happy to take any questions if you have. uh, Participants, if anyone has any queries, we can discuss. Anyone from participants? Uh, yes, we can.
Yes, sir. One question is that, as ma'am said lastly, that AI and empathy. So I do have a question regarding the empathetic AI, whether the current models, data-driven models, will be able to cope up with the empathetic behavior or not. They will be able to give or not.
Presently the people are trying to understand and able to do the solutions, but all these things, AI models, when we train, we require the data, and we require a diverse data. Everybody's need is different. Everybody's requirement is different. So, present status, it may not be, but I'm sure that future we will have more data because people have become more vigilant, and more data is now being available. And as we get more data, we'll be able to design and train our models better, and we should be able to provide very good solutions to everybody. Whatever is being shown in these Bollywood and Hollywood movies, that should be able to. We should be. That is what an artistic has thought, and scientists are going to realize it. So I am sure that this will be there, and this will be possible. Uh, these days we get things which is like I get recommendation now. I can get recommendation along with my desire, and that is how I'm moving towards that direction. And sooner or later we will be there. I hope
Thank
I've
you, ma'am.
answered. Yeah.
Yes, sir.
Anyone else want to discuss anything? I request participants, if they have any queries, please come forward. Okay, Monica ma'am, I think thank you very much.
Hello. Hello.
Hello.
Hello. Yeah, I just wanted to ask Monica ma'am, thank you for this elaborate session about use of these AI tools in different medical application. Could you please suggest some of those sites from where we can use AI on free basis to understand the basics, coming from life sciences, I do understand the application part, but how do we use it actually? That is something which is I'm not getting right links to use that. Could you suggest some of those sites which are free and I can train myself using them?
So you are from life science background. Yes, sure. So basically, what we are working on modeling the DFTs and other things on that. So I can send you some tools on that. But yeah, I can send you. Maybe I can send it to Janvi and she can forward it to you.
So please, thank you. That would be really helpful.
Yeah, sure. Thank you. I'll do that.
Thank you.
Ma'am,
Yeah.
can you suggest a few data claims for diabetic retinopathy?
So there are
various challenges that are there on Kaggle. You can use that. Then there are many databases like STAIR is a very hard database of retinal images, which work on that, which has the retinal images, which have various other artifacts also. Uh, I mean, there are more also. Maybe I only remember STAIR because that is very hard. I think I'll just share with the Janvi only because there are many databases. Drishti is one which is of Indian eyes, which also has these eyes issues. I don't remember offhand. I will be just sharing that.
Okay, ma'am. Thank you, ma'am. Anybody? Yes, ma'am.
Maybe on the Kaggle also there was some challenge, and last year there was a challenge in this some conferences also. So data sets, there are many free data sets which are available.
Okay, ma'am.
Okay.
This is for Janvi. Janvi, are we going to get the recordings of these sessions?
Yeah, definitely. We are going to upload it on YouTube channel and we'll be sharing
Okay.
in WhatsApp group also. So we can, refer afterwards whenever it is required.
Yeah, please. Thank you.
Yeah,
Thank you.
definitely. Yes. Any other participant want to discuss anything? Okay. Uh, okay. Monica ma'am, thank you so much for taking the time to deliver this extraordinary session on how future of healthcare is shaping with AI enabled. Despite the short notice, you made it happen seamlessly. Thank you very much. We are grateful for your contribution to our Atal Online FTP program. And definitely your lecture has added value to our learning experience. Thank you again. Uh, uh, Thank you, ma'am. Thank you very much.
Thank you, Janvi, for inviting me, and I hope I make some sense to you. And as I said, we are always looking for collaboration. If somebody is interested, please reach out to me. And we are always looking for students and collaborators. Thank you. Thanks a lot.
Definitely. Thank you.
Oh, bye.
Bye. Hello participants, our next session will be starting by 7:30. So let's have a break for 15 minutes. Please be joined, don't leave the meeting as our recordings are going on. So please be joined, don't leave the meeting. There is a hand raise from Rupa Rani. Do you want to say anything? You can ask in either chat or WhatsApp group.
Hello.
Hello.
Yes, sir.
Yeah. Good evening.
Good evening, sir. Okay, sir.
Okay.
Now should I start session, sir?
Yeah, please.
Okay, thank you, sir.
I'm sharing my
Welcome,
screen.
everyone. Yes, sir.
I'm just sharing my screen.
Okay. But sir, before you share screen, I will give brief introduction to participants, sir.
Okay. Yeah, please.
Okay. Welcome everyone to our second session of the day. It is my pleasure to introduce our distinguished speaker, Mr. Parth Gandhi, sir, Director of the Client Services at Samyak Infotech Private Limited, with a career dedicated to delivering innovative IT solutions. Mr. Gandhi, sir, leads a talented team of over 100 professionals providing services to global clients, including Fortune 500 companies. Under his leadership, Samyak Infotech has evolved from an instrumentation company into a leading IT solution provider, specializing in areas such as customized software development, mobile applications, IoT, cloud solutions, and advanced logistics technology. His deep expertise, particularly in the logistics domain, has enabled the design and implementation of impactful solutions spanning fleet, warehouses management, and route optimization. Mr. Rajesh vision goes beyond technical innovation. He emphasized building long-term client relationships, delivering quality, and driving success through value-driven propositions. His passion for staying at the cutting edge of the technology continues to inspire his team to embrace new ideas and deliver excellence. Today we will be sharing his insight on empowering elderly care with AI and robotics, innovations for enhanced quality of life, highlighting how emerging technologies can transform elderly care and improve the quality of life for seniors. Now, welcome, please, warm welcome to our second session expert, Mr. Parth Gandhi. Now, hand over to Parth Gandhi, sir.
Thank you, Dhawan, for the warm welcome and introduction. So
Now, sir,
let
you can
me,
share your screen, sir.
yeah, let me know once you see my screen.
Okay, now, sir, screen is visible, sir.
Okay, great.
If it is also visible, sir.
Okay, thank you. So thank you, AICT, a committee to arrange such wonderful online sessions and provide me opportunities to give lecture on empowering elderly care with AI and robotics. So, current as for my topic, like current global aging trends, like the world is witnessing an unprecedented demographic shift towards an aging populations. According to the United Nations, by 2050, nearly one in six people globally will over the age of 65, doubling the proportions compared to 2019. Developed regions such as Japan and Western Europe already face advanced aging, where the elderly form over 25 to 30% of populations. This trend is also accelerating in developing economies like China and India, creating new challenges in healthcare systems that were traditionally designed for younger demographics. With increasing due to medical advancements, lifestyle improvement, and lower fertility rates, so that societies are moving towards what is often called silver tsunami. Longer lives bring opportunity for active aging, but also higher risk of illness such as diabetes, dementia, and cardiovascular disease. Governments are responding with policy reforms such as if we say Japan, so they are like uh, open plan like super age society plan, and Europe also like health aging initiatives. So, like if we talk about challenges, so in challenges if we see like shrinking workforce, rising pension obligations, healthcare costs that surpass almost 20% of GDP in some nations. Families are become sandwiched, balancing care for both children and elderly parents. This global trend highlights why innovations in elderly care is not optional but essentials. Caring for the elderly involves a complex mix of medical, society, emotions, challenges. So first, there is a shortage of skilled resources, caregivers worldwide. Many countries already adopt a gap for millions of health worker professionals trained in different areas. So, and second one is elderly involved in often suffer from multiple chronic conditions, require continuous monitoring and medications. And third one is mobility issues and fall risk that impact independence and quality of life. So if you saw the studies, so studies show that like prolonged loneliness has health effects comparable to smoking 15 cigarettes a day. In rural and low-income regions, the challenges multiply due to poor infrastructure, limited access to healthcare facilities, families struggle with balancing work commits while caring for elderly relatives, leading to burnout. So if we talk about AI, like AI and robotics, how it helps, right? Technology, how it helps in these aging populations. So traditional approaches to elderly care are like labor incentive, costly and inconsistent. So AI and robotics provide solutions that are scalable, efficient, and increasingly personalized. AI enables predictive analytics, which can anticipate health risks such as falls or cardiac issues before they occur. Robots, on the other hand, can provide physical assistance, helping with mobility, rehabilitations, or even companionship. For example, machine learning models trained on health data that can help sign of, let's say, Alzheimer's disease, while robots like Pepper or Paro can reduce loneliness by engaging in interactive conversations or therapy. Unlike humans, these systems can work 24/7 without any issues, ensuring continuity of care. If we see if we don't replace caregivers by augment them, allowing professionals to focus on empathy and complex decision making. Real world deployments like in Japan, South Korea, such countries already involve robots in let live patients, monitor vital and remind them about medicines. Combined with telemedicines, AI and robotics can bring specialized care to remote or unserved areas, like remote areas. And like diagrams comparing traditional care versus AI-enabled cares that help us in reducing cost, error, and hospitalization rates. So let's talk about role of AI and robotics in improve of quality in life. So nowadays we know about healthcare 5.0, but let's first talk about previous models like what healthcare 1.0 or 2.0 or 3.0 helps. So if we talk about healthcare 1.0, so it generally focuses on sanitations and public health basis. Example, clean water and vaccines. Then it's come to healthcare 2.0, where we introduce structured hospitals and specialized medicines. Then it's come to healthcare 3.0, where we digitize with electronic health record and IT systems. In healthcare 4.0, we bought interactive connected health systems and cloud adoptions. Now, if we talk about healthcare 5.0, it's represent intelligence, patient-centered, predictive, and preventive care with AI, IoT, 5G, and robotics. The major shift in 5.0 is from institution-driven to patient-driven care. Hospitals no longer remain in the central hub. Instead, homes and communities become smart health centers. Another difference is move from treatment to continuous monitoring and personalized preventions. So in healthcare 5.0 means greater autonomy, reduced hospital visits, and proactive wellness management. So if we talk about like main objective of this lecture, so as I said, it's all about healthcare 5.0 program. So how like explore how AI and robotics are transforming elderly care under the healthcare 5.0. So first we need to understand global demographic trends that make innovations. Second is examine the specific challenges in elderly care that technology seeks to address. So what is, let's say, what if we talk about framework 5.0 framework. So in healthcare 5.0, it's a different components that unique relevance of aging societies. So those areas, if we consider like predictive analytics, chronic disease management, compensation tools, this will help, followed by deep dive into robotics, like different robotics type like cover, assistive, companion, service robots with some real world examples. And not lastly, we will cover a few emerging technology and ML, telehealth, edge AI. Those are shaping the next generations of healthcare systems. And finally, we will demonstrate few case studies, and if time permits, then we will do some interactive discussions on this healthcare 5.0. So if we talk about the definitions of healthcare 5.0, so in this fifth generation healthcare evolutions where traditional care systems transit into intelligence, interconnected and personalized ecosystems. Unlike earlier stages, which focus on digitizations and standardizations, healthcare fifth generation prioritize human-centric, technology-driven care. Its core components include artificial intelligence, Internet of Things like IoT, 5G connectivity, robotics, cloud computing, and big data analysis. The framework integrates like smart devices such as wearables, biosensors that continuously collect patient data. This data processed in real time through AI engine, enabling predicting diagnostics and preventing interventions. Robotics robotics health systems help like mobility, therapy, or even championships. Blockchain, nowadays if we see blockchain, so blockchain is often introduced to ensure secure and transparent data sharing across stakeholders. The unique of healthcare 5.0 lies in its patient-centric model. Unlike hospital-driven systems, care is decentralized into homes, communities, and virtual platforms. This democratics access and reduces strain on hospitals, visualizing the framework as a hub and spoke model with patient at the center and technology surrounding them. Helps to demonstrate how interconnected these components are. So if we talk about role of AI in healthcare 5.0, right? So how this AI is helping in healthcare. So AI is the central nerve system of the healthcare 5.0. It transforms like raw health data into actionable insight through algorithms, natural language processing, and predictive models. For elderly care, AI enables early diagnosis of any disease like Alzheimer's detections or any patterns invisible to human doctors. Machine learning models can process year of health history, lifestyle habits, and generic positions to predict risk. AI-driven chatbots nowadays, like all AI chatbots, right? So these AI-driven chatbots and voice assistants provide 24/7 patient engagement, answering questions and scheduling reminders. In critical care, AI helps emergency cases by analyzing data from smart ambulances or IoT devices before patient reach to hospital. A strong role of AI lies in personalized medicines by treatment based on genetic and behavioral data. AI reduces trial and error prescribing. For elderly populations, this minimize side effects and improve awareness. AI also power like computer visions for fall detections, smart camera for remote monitoring, and decision support tools for caregivers. So if we talk about this IoT devices, right, like we are wearing smartwatches. So how this IoT device help nowadays? So this IoT forms the sensory network in healthcare 5.0, continuously collecting data from patients, variables such as smartwatches, like gloves, monitors, EGC patches, allow real-time tracking of vitals like heart rate, oxygen saturations, and activity levels. For the elderly, this ensures constant monitoring without frequent hospital visits. IoT enable smart beds. Nowadays, if you see, hospitals are doing a lot of smart beds that can detect irregular breathing patterns, while motion sensors can identify inactivity that signals potential falls. Combined with AI, these devices generate predictive alerts for caregivers and healthcare professionals. For example, variables could detect irregular heart rhythms and automatically notify the cardiologist. The major advantage of IoT in healthcare 5.0 is remote patient monitoring. So it empowers seniors to live independently while still under the medical supervisions. So if we talk about this 5G connectivity, now we are transforming from 4G to 5G, and government are like involved very actively for upgrade infrastructure from 4G to 5G. So if we talk about 5G connectivity, so like 5G acts as a digital backbone of healthcare 5.0 with ultra low latency, we can say like less than 1 millisecond, and high bandwidth. It enables seamless communications between IoT devices, AI systems, and caregivers. For elderly cares, the translates into real-time monitoring without delays. A fall detection sensor, for instance, can alert a caregiver instantly, allowing interventions within a minutes. 5G also support like high definitions of like telehealth consultancies, where doctors can remotely access patients with almost no lag. Advanced use cases including like remote robotic surgeries, where surgeons control robots in real time across continents. For seniors in rural areas, 5G powered telemedicine breaks barrier of geography and accessibilities. The combinations of like 5G and edge computing ensures that critical health data is processed near the source, reducing the risk of data congestions and downtime. This is like what you can say, essential important for emergencies such as cardiac arrest, where every second is important count. So if we talk about real world pilots, like where China uses 5G ambulances equipped with diagnose tools, transmission live patient data in route to hospitals, like from patient to variables, like any IoT devices through 5G, it's connect to the AI engines, and AI engines it provide direct data to the caregiver. So it's so how instant feedback loops are created. So in short, like 5G ensured that healthcare 5.0 is not just intelligent, but also responsive and real time. So if we talk about like personalized care and smart systems, so smart systems for like elderly. So these smart systems are specialized technology solutions that integrate IoT, AI, robots, and 5G to address specific needs. Example like include smart homes equipped with motion sensors, voice assistants, connected appliances that ensure safety and convenience. For instance, light can automatically turn on when an elderly person wake up at night, reduce fall risk. AI-driven monitoring platform can assess sleep quality, nutrition, and activity levels, providing caregivers with detailed wellness reports. And if we talk about robotics, if we like robotics integrated into smart system, support mobility, such as like robotic walkers that help senior to maintain independently. This system also improve emotional well-being. Virtual assistant like Alexa, right, or Siri, or specialized elderly care bots can provide reminders, play music, or even engage in casual conversations to reduce loneliness. Integrations with healthcare provides ensure that anomalies detect at home trigger alerts for medical interventions. So if we talk about like real world examples, so recently like Sweden deploys smart elderly homes where IoT devices track daily routines, deviations trigger wellness checks, and like visual of connected homes with icons for wearable robots, sensor helps or the audience see how these systems work together. Ultimately, smart systems create an environment where elderly individual feel safe, supported, and independent. So, in smart system, how these robots are integrated. So, if we talk about robotics, cornerstone of healthcare 5.0, so it's provide physical, cognitive, and emotional support to the elderly. Unlike like isolated robotic solutions that integrate robots are connected with AI, IoT, and healthcare databases. This creates a seamless ecosystem where robots act as an extension of medical teams. So for mobility, like robots such as Skelson help elderly patient regain independence by accessing with walking and physical therapy. Champion robots like Paro or Peeper provide emotional support, reducing loneliness and depressions. And then if we talk about service robots, so that can deliver food, medicines, or assist in daily household help. So integrations means like like robot that don't work in silence. They communicate with IoT, cloud systems, and caregivers. For example, robotic walker who detect irregular heartbeats via built-in sensor and automatically alert doctors. So, like countries like Japan and South Korea have already deployed such integrated systems in nursing home, showing improvements in both physical health and emotional well-being. So, if we talk about patient-centric systems like patient-centric care, right? So, at the heart of the healthcare 5.0 is patient-centric care, where the elderly individual is no longer a passive recipient, but an active participant in managing their health. Traditional health model often revolve around hospitals and physicians, but healthcare 5.0 shift focus to the home and community. So if we talk about different AI models like predictive and preventive models, so these models emphasize moving from reactive care, like treating illness after they occur, towards predictive and preventive models. The transformation is especially critical for elderly populations where detections can dramatically improve outcomes. So predictive analysis powered by AI identify like worm signs or disease. For instance, analyzing any changes through smart tools or sensors can predict fall risks weeks before an accident occurs. It's like preventing based on different patterns, based on the data analytics, everything. And if we talk about preventive, so preventive care goes hand in hand with this insight. Once risks are identified, AI-driven systems suggest lifestyle interventions, personalized diet plan, medication adjustment, and this preventive remind like hydrations or physical activity that delivered via smartphones or robots. Now, if we move how AI, we talked about robots, right? So now if we talk about AI in elderly care, right? So as we discussed like this predictive analytics, health monitoring, and virtual assistance. So let's talk more about predictive analytics. So predictive analytics like uses AI algorithm and big data to forecast potential health events before that happen. For elderly care, this means analyzing medical history, variable data, lifestyle pattern to anticipate disease or emergencies. For example, like if there is any change in walking speed or balance captured by sensor, can predict fall risk weeks in advance. Similarly, analyzing heart rate, variability, and oxygen level may flag early sign of cardiac issues. Healthcare provide benefit as they can intervene earlier, preventing hospitalizations and costly treatment. Productivity tools also help allocate resources more effectively, ensuring high-risk patients receive timely care. So AI models like IBM Watson or this Google DeepMind have demonstrated predictive accuracy in detecting conditions such as kidney failure or species. In elderly case, smaller scale solutions include home monitoring platforms that alert caregivers of unusual behavior patterns, such as let's say like if they miss some meals or disturb in sleeps. So if we talk about like predictive like health monitoring, so let's say fall risk detection. So how it works? So falls are leading cause of injury and hospitalizations among the elderly. So AI-driven fall detection systems combine sensors, cameras, and machine learning to identify risk and send alert instantly, unlike traditional panic buttons, which require manual activations and activations. These AI systems are automatic and proactive. Computer vision models can analyze real-time video feeds to detect abnormal movement patterns such as stumbling or sudden downward motions. These variables equipped with accelerometers or different type of sensors that sense unusual impacts or changes in orientations. AI enhances accuracy by filtering false alarm caused by binding or sitting. Beyond detection, predictive AI models can also anticipate falls by monitoring patterns or reduce mobility. These enable interventions such as recommend physical therapy or mobile mobility aids. So if we talk about real world example, so like nowadays devices like Apple Watch that have inbuilt sensors for fall detections, which automatically contact emergency service if a user is immobile after a fall. Similarly, in Japan, as we talk like smart home system, use AI-powered floor sensors. Those are installed on the floor and that provide alerts in nursing home. So by this fall detection, power by is not just a convenience, but it can be life-saving. Similarly, if we talk about chronic disease management, So like in chronic diseases such as diabetes, hypertension, anemia that affect elderly populations, AI support management by enabling continuous monitoring, personalized treatment plans, adaptive interventions. For diabetes, AI analyzes blood glucose data from continuous monitors, predict dangerous fluctuations, allow timely insulations adjustment, right? So these cardiac care predictive models access stroke and heart attack risk based on patient history and lifestyle data. For dementia, AI tools track cognitive decline patterns and suggest cognitive exercise. AI-driven platform like that integrate with healthcare monitoring systems, right? So that cover electronic health records to provide doctors with a historic view of patient data that reduce medical errors. Virtual health coaches powered by AI deliver personalized diet and exercise advice, reinforcing long-term disease control. Like one example, if I give like, if you can say this, Flamingo Health, right, which combine AI analytics with coaching to improve outcomes of patients with chronic conditions. Another is Omada Health, using AI-based insight to support lifestyle interventions. So ultimate point is like through sensors, AI analytics, and patient dashboard, like health monitoring systems that provide a dashboard to user, a doctor, that illustrate how AI connects patient, caregivers, and providers. So if you talk more about on this AI-powered monitoring devices. So this AI-powered monitoring devices acts as a digital caregivers. This includes smart cameras, variable biosensors that are connected with medical devices that continuously track vital signs and behavior. For example, like with ECG capabilities can detect any unwanted rhythms, right? So one AI-enabled blood pressure cuffs can analyze long-term trend instead of isolated reading. In dementia care, AI-powered sensor monitor behavior and trigger alerts when patient leave safe zone. Some devices also like beyond the health metrics to track daily activities such as eating, sleeping, or movement patterns. AI algorithm flag anomalies like skipped meals or prolonged inactivity, potential health concerns. These insights are then shared with the caregivers via apps or dashboard. There are a lot of commercial solutions are available like Care Predict, which uses AI variables to monitor seniors through like their daily habits, bioformals, which provide AI-driven remote patient monitoring platforms. So if we talk about benefits, so as we discussed, like benefits like early interventions, independence, reduce hospital visits, right? So let's say if we take example of virtual assistants. So this AI-powered virtual assistants provide both like practical support and compensatives to individuals, seniors like. So these assistants can be voice enabled like Alexa or Siri or Google Assistants or any specialized healthcare boards designed for seniors. On the practical side, they remind users about medications, appointments, hydration schedule. They also help seniors control smart home devices, light, doors through simple voice command, improving accessibility for those with mobility issues. On the emotional side, virtual assistants engage in small talk, play music, tell stories, helping in reducing loneliness, isolations. For dementia patients, they provide orientation prompts like reminding the time, date, upcoming events. Healthcare integration is another strength where AI assistant can connect with doctor via telehealth, share patient data, and even schedule follow-ups automatically. For example, this Catlia Health that develop like Mobu robots that serves as a conversational AI coach for senior patients managing chronic lysis. So this virtual point is like this virtual assistant reach the gap between the technology and human connection, making senior care more accessible, interactive, and humanized. If we more talk about on medication reminder. So this medication awareness is one of the biggest challenge in senior care, as many seniors manage multiple prescriptions for chronic conditions. So these AI-powered reminder systems address this by providing timely, personalized notifications through smartphone, smart speakers, or robotic assistants. This reminder can go beyond simple alarm. AI analysis uses patterns and adapts reminder based on patient's behavior. For instance, if an elderly person consistently delay monitoring doses, the system can adjust the reminder tone, timing, and method, like switching from soft time to a variable prompt. Integrations with smart pill dispensers ensure accuracy by realizing the right dose at the right time. In case of dose is missed, then system notify caregivers or family members. So like they can immediately contact the patients or senior to take the dose and required medicines. This reduce risk of overdosing, underdosing, or harmful drug interactions. So like recently, like this one startup like MadeMinder, which combines smart pill boxes with AI alerts and Hero Health, offering automated pill dispensing link with the caregiver dashboards. So it's like pill box itself includes sensors which with AI connections with smart systems. So point is this AI medications reminder directly reduce hospitalizations and improve treatment outcomes for seniors. So similarly, if we talk about championships through AI, so loneliness is hidden epidemic among the elderly, strongly linked to depressions, cognitive decline, and even premature mortality. AI technology provide these championships through conversational agents, social robots, and emotionally intelligence assistants. So robot like Paro, the seal, is designed for rapid engagement, especially in dementia care by responding to touch and sound in soothing ways. Virtual companies like these companies like Elic and Replica engage seniors in conversations. Even they are now provide play games and encourage social interactions. AI companies are not meant to replace human relationship, but to fill emotional gaps when family or caregivers are not present. They offer a sense of routine, reduce isolation, and prompt positive mental health. Importantly, AI can adapt conversations to individual personalizations, create a sense of familiarity and connections. So similarly, if we talk about AI for cognitive supports, right? How this AI support independently. So cognitive decline is common among senior individuals, manifesting as memory loss, confusion, or difficulty in daily tasks. So these AI offer tools for cognitive supports ranging from memory aids to interactive brain training programs. Voice assistants can provide contextual reminders like, hey, it's Monday, your yoga class is at 10, helping orient patients with dementia. AI-driven apps deliver cognitive games that adapt difficult level based on performance, stimulating memory and attentions. AI can also track behavior changes that signal early cognitive decline. For example, speech analysis tools that can detect hesitations or vocabulary loss, serving as early indicator of Alzheimer's disease. In practice, tools like Cognifit and Brain IQ. So these are like startups that uses AI algorithms to personalize mental exercise, while AI-based chatbots engage seniors in conversations to simulate cognitive functions. So by using this AI, right, or these robots, how it benefit in senior care, elderly care. So the adoption of AI in elderly care brings multiple benefits across medical, social, economic dimensions. First, AI ensure continuous monitoring without overwhelming caregiver, leading to faster interventions and reduce hospital visits or even hospitalizations. Second is predictive models enable proactive healthcare, shifting focus from treatment to preventions. For elderly individuals, AI provides greater independence through virtual assistants, medications reminder, and mobility support. Families get peace of mind knowing that their loved ones are being monitored and supported even from far. Healthcare provides benefit from data-driven insight that reduce workload and enhance efficiency. Economically, AI reduces the burden on healthcare system by lowering emergency admissions and optimizing resource allocations. Socially, AI-powered comprehensive tools address isolations while cognitive support system maintain mental agility. So if we see like by using AI, if we see the like government data, so it saw a decline in remediation rates in facilitating adoption of AI-based monitoring. So what challenges and limitations of AI in this AI elderly? So if we talk about challenges and limitations, so despite its potential, AI in elderly care face significant challenges, like data privacy is major concerns, right? Because we are continuously capturing data either through sensors, cameras, variables, right? So main is data privacy, then sensitivity health data must be protected from misuse. Many elderly individuals also struggle with digital literacy, making adoption difficult. So AI algorithm may show bias if trained on non-representative datasets, leading to inaccurate predictions for diverse populations. False positives in fall detections or monitoring can frustrate users and caregivers. Affordability, right? So affordability is another challenge because as many AI-powered solutions remain expensive, limiting access in low-income regions. Next is like technical limitations such as device battery life, network connectivity, interaction issues also hinder widespread use. Moreover, ethical concerns arise around replacing human touch with machines. Robots may support but cannot replace emotions formed with family. Healthcare professional may resist like to adopt adoption due to lack of training or fear job replacement. Finally, regulatory framework are still evolving, creating uncertainty in deployment. So if we talk about different type of robots, right? So yeah, so there are different type of robots like assistive, convenient, and service robots. So these assistive robots help with tasks such as lifting, feeding, or mobility, right? If we talk about companion robots, so companion robots provide emotional support through conversations, face recognitions, and responsive interactions. Social robots perform household things like cleaning, cooking, medications, like delivering medicines, dispensing for seniors. Then rehabilitation robots that provide physical therapy and help restore movements. And like mobility robots that provide support with walking, navigations, fall predictions. So if we talk more about, like, let's say our first robot, like assistive robots. So assistive robots are designed to support daily activities and physical needs that enabling greater independence. They can help with lifting heavy objects, assisting with eating, or transferring patients from beds to wheelchair. Robots like Riba 2. Now, initially we have Riba 1, but now Riba 2. So is a robot for interactive body assistance, Riba. So in Japan, they are capable of lifting patients safely, reducing strain and caregivers. Other assistive robots include robotic feeding arms that help senior with limited motor skill eat independently. Some assistive robots integrate with AI to detect when help is needed. For example, if elderly person attempt to stand but show instability, the robot can provide support or alert caregivers. These robots also reduce caregiver burnout by sharing the physical workload. If we talk about companion robots, so these companion robots target the emotional and psychological well-being of elderly individuals. Loneliness is a critical issue among seniors, and these robots provide social interactions, engagement, and comfort. So there are robots like Paro, that robotic babysitting is widely used in dementia care. It responds to touch, sound, and light, providing a calming therapeutic presence. Second is like Pipper, a humanoid robot, engaging conversations, answer questions, and even dance to entertain seniors. Yeah, it's very interesting, like dancing with seniors. So, like you, another example where encourage seniors to stay active, connected, and mentally stimulated. So these robots use natural language processing, facial recognitions, and adaptive learning to personalize interactions. For instance, a robot may remember an elderly person behave favorite music, right? Or daily routine and adapt behavior accordingly. So these are self-learning robots. So studies show that these robots reduce stress, anxiety, and symptoms of depressions in senior populations. Nursing home in Japan and Europe report improved resident satisfaction after integrating these robots. Now talk about service robots. So service robots more focused on practical and routine tasks that support day-to-day living. They can clean homes, deliver meals, fetch items, or even remind elderly individuals about upcoming appointments. Unlike assistive robots, which provide physical aid, service robots enhance convenience and efficiency. Example include vacuum cleaners, automated kitchen helper, delivery robots in care facilities. More advanced version like Jura act as a multi-purpose service provider. Support staff in nursing home by guiding exercises, monitoring patients, and delivering supplies. These in AI, like these robots are AI integrated to optimize tasks. For instance, a robot delivering medications can navigate around obstacles using real-time mapping. It's called like SLAM, SLAM technology. Some are voice controlled and allow seniors to request tasks on demand. Service robots also reduce caregiver workload by handling repetitive tasks, ensuring caregiver focus on human-centric responsibilities. If we talk about mobility support, right? So mobility is one of the most significant challenge for the seniors, as reduced muscle strength, arthritis, or neurological conditions often limit independence. So robotics for mobility support address these issues by offering walkers, wheelchairs powered by AI and sensors. Robotic walkers, unlike this traditional one, now these robots are equipped with obstacle detections. So they have sensors and camera that detect obstacles, navigation systems, right? Preventing accidents, right? If we heard about this driverless car, right? So these cars are all fully equipped with all obstacle detections, navigation systems, preventing accidents, right? Similarly, now those equipments are fit in wheelchairs. It's called smart wheelchair that allow voice or gesture control, enabling seniors with limited mobility to move freely. So even nowadays in India, right, robotic mobility they are widely used in nursing home, where seniors can walk safely while being monitored. AI enhance the system by adapting to individual patterns and provide real-time feedback. If we talk about these rehabilitation robots, so these robots are designed for therapy and recovery, particularly for conditions such as strokes, fractures, right? And these robots provide repetitive, precise movements that are essential for effective rehabilitations, but often exist for human therapies. Robotics can guide patients through exercise, adjusting resistance and range of motions based on progress. AI enhanced therapy by personalizing routines, monitoring performance, and conducting difficulty levels. Example include like Locomate. I think that is in recently by MIT. Yeah, these Locomate robots are git trainer, which help patient like real arm walking and arm therapy. Yeah, so they are basically for arm therapy for upper lip rehabilitations. These robots reduce therapy figures and increase consistency, enabling seniors to make faster progress. So as I give two example already, right? Paro, Paper, Zora. So if you see this Paro, perpetual BBC robot is used widely in dementia care. It responds to touch and sound, providing comfort and reducing agitations. It has been successfully deployed in nursing home across Japan, Europe, and western part of US, even in North America also. If we talk about second one, this humanoid robot capable of natural conversations, emotional recognition, and entertainment. In elderly care, it assists with engagement activities, patient orientations, and even basic health guidelines. Zora is a multifunctional robot. It widely deployed in European nursing homes. It support rehabilitation exercise, deliver reminders, and entertain residents. These robots exemplify the diversity of roles from therapy to engagement to daily support. Research show, like if you see the different research, it show benefits in improved mood, reduced stress, increased willingness to patient in care activity. So if we see robotics in daily tasks, so robotics also play a vital role in supporting everyday living activities such as cooking, cleaning, dressing, feeding. Many senior individuals want to remain in their home but face challenges with daily chores. So robots can help in the day-to-day task and bridge this gap. For example, robot kitchens assist can chop vegetables, cook meals, or remind user of dietary restrictions. Smart robotics app can help with dressing or grooming, ensuring dignity and independence. Cleaning robots such as robotic vacuums and laundry fold machines reduce physical strain. So, impact on mental well-being, right? How these robots, these Pepper, Zora help in our impact on mental well-being. So these robots not only address physical needs but also contribute significantly to mental and emotional well-being. Loneliness, depressions, anxiety are common among seniors, especially those live alone in home or in remote area. So these companion robots provide comfort and engagement, reducing isolations. Humanoid robots like Pepper initiate conversations, play games, or guide group activities in nursing home, fostering social participations, right? Robotics also create a sense of security by being available 24/7, which reduce anxiety about emergencies. Knowing that robot can call for help in case of distress, improve peace of mind. So these robots are basically a caregiver support. Robots are equally important in supporting caregivers. Often face burnout from the physical and emotional demand of elderly care. Robots can share the workload by lifting patients, performing repetitive tasks, and monitor health indications. For example, as we already discussed, like robot reduce the risk of back injury for nurses transferring patient from one bed to wheelchair or any another bed, or if you need to move from one room to another room, right? So this robot helps nurses from back injury. Service robot handle like day-to-day delivery, like not delivery, but delivering in supplies, allowing caregiver to focus on patient interactions. Monitoring robots track vital signs and alert caregiver only when interventions is needed, reducing constant manual check. These AI enable dashboards. Like these all robots are connected with AI systems. So this that enable AI dashboards that connect to robotic systems also provide caregiver with real-time data, improving decision making, and this support leads to reduced stress and higher job satisfactions. So now if we talk next is like emerging trends and technology for healthcare 5.0, like this AI-driven predictive healthcare, that transforming elderly care by shifting focus from reactive treatment to proactive preventions. By analyzing large data set from electronic health records, wearable devices, and lifestyle inputs, AI identify patterns that predict potential illness. For example, AI model can detect early sign of Alzheimer's disease years before symptoms appear, enabling intervention that slow progress. And predictive tools can also forecast risk of falls, heart attacks, or infections by monitoring subtle changes in mobility, heart rate, and daily activity. So this AI-powered health monitoring, right? So as we discussed, these wearable devices, home sensors, tackle vital sign and detect falls in real time for early health intervention. Now smartphone, right? So many people already use Alexa or Google or Siri, right? To even we have these all AI or IoT enabled refrigerators, TV, smart TVs, even smart washing machines, dishwashers, right? So how the smartphone integrations work? Smart home equipment with IoT technology create a safe and supporting living environment. So sensors, variables, connected devices monitor movement, detect anomalies, and automated household functions. For instance, motion sensors can alert caregiver if elderly person does not get out of bed at their usual time. While smart stops automatically switch off to prevent accidents. Voice control systems allow senior to control light, doors, right, and thermostats without physical strain. These homes also support remote monitoring, like collect data by IoT devices, send it to caregivers or healthcare provider in real time. If any abnormally or irregularity heart rate or prolonged activity detected, then alert is triggered. Then robotics for home care, right? In smart home, if we talk about robots, so these are emerging as essential tool for senior individuals who prefer to live in their own home rather than move to living facilities. These robots provide daily assistance, safety monitoring, and championships. For example, robots can remind senior to take medicines, bring them glass of water, or assist with mobility by guiding them safely around the house. Some robots also provide entertainment, reading loud, playing music, engaging in casual conversation. AI integration allows these robots to adapt to user preferences and habits. If senior usually eats lunch at noon, the robot can remind them or even prepare simple meals. Robotics for some home care also reduce caregiver visit and saving costs while maintaining safety. Now this telehealth service, how this telehealth service works, right? On the call, it's like on the call. So this telehealth service has become a cornerstone of elderly care, especially after COVID, right? COVID-19 pandemic, accelerated digital adoptions. It allows seniors to consult doctor remotely, reducing the need for travel and hospital visit. AI enhanced telehealth by enabling symptoms analysis, triage, and remote diagnostics. For instance, chatbots can access symptoms and direct patient to appropriate care level. Doctor can review data from connected devices such as blood pressure cuffs or glucose monitors during virtual consultations. Telehealth platform also integrate with pharmacies, enabling online prescriptions and medications delivery. So, like all systems are what you can say connected, from patients to doctor to hospitals or to pharmacies, and pharmacies to supply chain system like logistics for delivering medicines at home. So for elderly patient in rural or unserved area, telehealth brings the accessibility gap. Similarly, medication management tools. Nowadays, a lot of medications tools are available. So these medications error are common cause of hospitalizations among seniors. So such emerging technologies provide AI-powered medications management tools that ensure awareness, accuracy, and safety. Smart pillboxes, right? We discussed earlier. These pillboxes integrated with sensors, AI, that release correct doses at the right time, while apps send reminder and track compliance. This system can alert caregivers if a dose is missed. AI also helps identify potential drug interactions by analyzing prescriptions in real time. Advanced platform integrate with electronic health record, enabling doctor to monitor remotely. Now, this Chinese machine learning, ML, so machine learning, right? So it refers to running algorithm directly on small, low power devices like variables. For elderly care, this means that smartwatches, ECG patches, or glucose monitors can process data locally without relying on constant cloud connectivity. The advantages is real-time analysis with minimum latency. Right, we earlier discussed about 5G connectivity, right? Now we are moving from 4G to 5G. So with 5G, we have a real-time analysis. So these all variable would detect irregular heart rhythms instantly and issue an alert before synchronizing data with the cloud. This is critical in emergencies such as cardiac arrest or falls. So this tiny ML machine learning also reduce energy consumptions, extending battery life. That is important factor, right? Because if things are not charged on time, so we need a long run battery life. Now if we move to case studies. So we have some interesting case studies. So first is Dewey. So Dewey robots, what is for specifically for Alzheimer patients, where we have issues of memory loss, right? So this Dewey robot developed in Western Reserve University, and it's a notable example how robotics can enhance elderly care. It was designed to assist seniors with both physical and social needs. These robots combine mobility assistance, health monitoring, and conversational abilities, making it a multifunctional care partner. Dewey uses sensors to detect any heat or balance, helping seniors walk safely and avoid fall. It can also carry lightweight items, reducing physical strain on senior users. Integrate AI allow it to engage in simple conversations, provide reminder, and offer campaign tips. In pilot trial, Rui was shown to reduce caregiver workload by automating routine monitoring tasks. Caregiver receive alert when the robot detect unusual pattern in movement or any vital signs. Senior reported higher confidence in mobility and felt emotional support by patients. If we go next case studies is on Gemly. Gemply. So this is AI-powered remote monitoring solutions with focus on senior care like elderly care home. It uses unobstructive sensors. Those are placed in homes to track daily activities like sleeping, eating, movement without requiring variables or cameras. This makes it highly acceptable to seniors who dislike intrusive monitoring. So AI algorithm analyze pattern and detect deviations such as a sudden reduction in meal preparations or irregular sleep cycle, right? So these anomalies often indicate health concerns such as depressions, cognitive decline, or illness. Caregiver receive timely alerts through dashboards and mobile applications. So we have few more case studies also. So even if we talk about this simply, right? So that also pilot in US and India, showing strong result in reducing hospitalization rate and improve early interventions. Family appreciate the privacy first approach since no video or constant human observations is involved. So in Japan hospitals, the people, so that is SoftBank humanoid robot that involved deploying Japanese hospital and elderly care facilities to provide social interaction, orientations, and support. This can recognize faces, detect emotions, and engage in natural conversations. In elderly care, there is one more is RO, dementia care, right? Then we have like fall detections robots, right? Then recently, like in India, Tata Trust, they have started elder spring initiatives. So Tata Trust launched AI-based elderly care platform under its Elder Spring initiative, focus on telehealth, mental wellness, and community-based monitoring. Partner with startups for AI-powered call centers and health monitoring tools that aims to scale solutions for rural and semi-urban India. Then recently, Kerala government also initiate a pilot on telemedicine for citizens in rural areas. So senior uses kiosks and mobile apps to connect with doctors. IoT device track their vitals like BP, sugar, heart rate, and trigger cases as and when needed. And that's supported by state government. It is like I think it's under Ardhamar missions. Yeah. Then even our IITs and startups. So recently, IIT Madras and IIT Delhi have worked on low-cost robotic process for rehabilitations designed for stroke and paralysis patients, even in lighter and more affordable compared to Western versions. Startups like Chill Robots, that is Thomas for Bandicoot Robot, are pivoting some R&D into healthcare robotics. Even there are some NGOs also available. So those are mainly in like cities like Bengaluru and Pune. Those are using AI-driven chatbots and voice system to support senior citizens. This system provide reminders, emergency assistance. Then like smart home in Sweden, as we already talked, like they have installed smart sensors, AI systems in through municipalities and private providers. These homes include motion detectors, door sensors, smart stoves that prevent fire hazards, AI energy daily activity pattern, and navigation such as skipping meals and reduce movement. Then in Canada also they have adopted like large scale remote monitoring program for senior populations, especially in rural and underserved areas. These programs leverage AI and IoT telehealth platform to extend healthcare access. We already talked about these AI chatbots and voice assistants. So what is lesson learned? So across these case studies, several key lessons emerge are like first one is user acceptance is critical. Elderly individuals are more likely to adopt technologies that are intuitive, non-intrusive, and empathetic in design. Second is privacy and trust must be prioritized. Third one is success often come from integrations, not standalone tools. So smart homes, AI monitoring, and robotics work best when connected to caregiver and healthcare systems. Fourth one is like affordability, remain challenges. Countries with strong public healthcare, like few European countries, let's say Sweden, like achieve this broader adoption than those relying on solely on private models. Fifth one is human caregivers remain irreplaceable. Technology augments care but cannot substitute empathy, cultural understanding, or personal touch. And finally, continuous improvement is needed. Mainly pilot projects show promise but scaling across diverse populations. Now, we talk a lot upon AI and everything, right? But ethical and implementation challenges, because everything is on cloud data, right? And privacy is most important, privacy and data security, right? So privacy is what concerns. So privacy is one of the most basic ethical challenges in AI, and robotics enable elderly care. This system continuously collects sensitive health data such as vital sign, medication schedule, even behavior pattern. Without strong safeguard or framework, such data could be misused, leading to identity theft, discriminations, or loss of trust. So blockchain, right? So blockchain-based health data sharing is being explored to improve transparency and trust. A regulatory framework like GDPR in Europe or HIPAA in US already impose strict rules, that implementations in elderly care technology remains uneven. In practice, solutions must take balance between safety and privacy. Now, if we talk about cost, like cost barrier and accessibility. So the high cost of AI powered devices, because we need to continuously train model, and for training models on this big data require lot of GPU and lot of power, right? So high cost of AI powered devices, smart home, these all smart home need a lot of sensors and robots, often limit accessibility, and especially in low and middle income countries. Advanced robot can cost thousands of dollars, making them unaffordable for many families. Elderly population in rural and underdeveloped regions faces additional barriers, including lack of internet connectivity, poor infrastructure, limited digital literacy. Without substantial or public funding, technology risks widen the gap between the wealthy and disadvantaged for seniors. So, like as I said, like government and NGOs are already working on the affordable model. Next is human touch versus automations. So while AI robots provide efficiency, they cannot replace the human touch. That is often critical in senior care. Senior values empathy, cultural connections, and emotional understanding. Right? So over automation is making impersonal, where seniors interact more with robot than the caregiver or family members. This can lead to feeling of isolations rather than inclusion. Ethical deployment requires that robots and AI agreements not replace human care. Then ethical and inclusive design. So AI and robotics in let's say AI and robotics in elderly care introduce a new ethical dilemmas that policymakers and caregiver must address, like autonomy versus safety. Should an AI should system override a senior decision if it detects danger, right? So at least these robots should not override senior decisions in some cases based on the is ultimately case to case basis. And another is privacy versus monitoring. How such surveillance is acceptable to ensure safety. There are also questions of consents. Many elderly individuals with dementia or cognitive decline may not fully understand how AI systems work. Obtaining meaningful consent from them is complex. Then scalability in developing countries. If we talk about developing countries like India, right? So scalability is major challenge because of technology in developing nations. While AI and robotic solutions show promise in advanced economies, the deployment in countries with limited infrastructure, high poverty, and weak healthcare system is difficult. That barriers include cost, unreliability internet, low digital literacy, and lack of trained caregivers to operate this technology. Like for example, telehealth platform that requires smartphone or stable connectivity, which may not be a vital available in rural areas. So if we talk about solutions in like human in the loop and scalable modes, right? So human in the loop approach that technology support but does not replace human caregivers. So scalable and affordable models. So use open source technology and scalable models makes advantage of senior care, right? Then if we talk about regulatory framework, right, and stakeholder engagement. So what is future outlook, right? So we are in 2025, but if we talk about future outlook by 2030, this elderly care will be transformed into proactive, personalized, and technology-powered ecosystem. Healthcare 5.2 principles like AI, IoT, robotics, and 5G, maybe in 2030 we have 6G also, will converge into a fully integrated care platform. So it's not just in hospital or nursing home, but also in smart communities and connected home. So if we talk about policy, funding, right, research directions, so there are a lot of things are involved in future outlook. So now we are almost at the end. So just if we talk about takeaways of these sessions, so where knowledge, skill, and impact. So we need to stay future ready, like gain insight into AI, robotics, and healthcare 5.0, that trend shaping the future of medical and caregiving practices. Right? Then we need to do a skill enhancement, where learn practical applications of AI or tiny machine learning for real-world healthcare challenges. Then research opportunities, like explore interdisciplinary research area in AI-driven elderly care and robotics. Then we need to also our curriculum development, integrate cutting-edge technologies into teaching modules and student projects. Industry collaborations, to understand how to align academic expertise with healthcare and technology industry needs, and innovations and entrepreneurships. So identify opportunities for startups and innovations in assistive technologies. So these are few takeaways. So yeah, thank you everyone. Hello. Yeah. Thank you.
Hello, sir.
Dhaval, your voice is breaking. I'm not able to hear you. Sorry.
Hello.
Yeah, Dhaval.
Hello.
Yes, Dhaval.
Yes, sir. Sir, my
Your voice.
audible, sir?
Yeah, now is audible. Initially, it's not break. Can you repeat again?
Okay. Sir, wait a minute. I will unmute the mic of participants. Yes, this mic is unmuted. Participants can ask this question, sir.
Okay, yeah, please.
Sir, I have a question, sir. Is there any simple solution for us?
Sorry, Dhaval, your voice is breaking. I'm not able to hear you properly.
Sir, is there any solution for Alzheimer disease people?
Yeah, as I say, Rui is a very personalized solutions for Alzheimer patients.
But sir, its cost is very high, I think so.
Yeah, so as I said, this healthcare 5.0 is very initial stage. Once we have lot like new startups, technology giants are involved, then in coming years the cost will definitely going down.
Okay. Then apart from sir, I have a question for the diabetic people because in older age it is very difficult to point this needle and capturing the blood. So is there any technology available, non-invasive method available for that?
So as I say, there are like supportive robots, right? So they help in this area with very precise level.
Actually, sir, I saw a video in one of the where one person designed an app so which measure diabetes using ID scan.
Mm-hmm.
But it is available in US and still they are verified. They didn't get the approval from FDA.
Yes. So as I said, the what we can say government approach and what we can say research policy and funding, a lot of things are involved in this because ultimately data privacy is very
Yes.
big challenge. Yes.
Okay. Apart from sir, I am also trying to make AI AI-based solution for diabetic retinopathy. But
Okay.
still accuracy is not up to the mark.
Mm-hmm. Yeah, so as I said, like we need lot of big data, like lot of data sets to train the model.
Yes,
And
okay, yes, sir.
yeah.
Hello? Hello?
Yes, ma'am.
Hello. So I request you to provide some research papers or authenticate data sets so that low cost hardware can be developed for healthcare. Actually, my kid is an autistic kid. So just like elderly patient, she is not able to communicate even what she's going through or how she's feeling.
Okay.
So it is very tough for parents and caregivers also, even therapists also, to
Right.
judge which kind of physical pain or mental trauma she is going through. So is there anything which can help us monitor her health during her sleep? Even in daytime we can observe her, but in night time we are not able to observe her situation.
Right. So nowadays there are few variables available which detect the nerve system.
Okay.
Yeah.
So can
Not
you
sure
provide us
about.
some papers or something?
Yeah,
From which we
sure.
can learn how to develop low cost hardware for such kits.
Sure. I will share. I have few material available. I will share with the coordinator, and then he will share with you.
Okay, so thank you.
there any question from others? I think no one has question. Okay, sir. Thank you, sir. On behalf of all participants, I sincerely thank you, sir, for this enlightening session. And we greatly appreciate the practical perspective and real-world examples you shared, which have broadened our understanding and motivate us to explore innovative solutions in this field. Thank you, sir. And thank you, sir, for giving us valuable your time, sir.
Thank you for giving me this opportunity.
No, sir,
Have a good evening.
Good evening, sir. But we have shown a very real-world example. Great, sir.
Yeah.
Thank you, sir. Thank you.
Yeah. Thank you, everyone. Bye.
Bye. Bye. Thank you, sir.
All participants can wave now. Thank you.
அது கேட்கல. அதுவும் கேட்கலடி.